Good afternoon, Dr. Marvin.
John, it's a beautiful day. You always bring nice weather and good questions to boot.
Well, I wish I could take credit for most of them, but this one comes from Cynthia, and I've been thinking a lot about it. And we talk about what won't help topical steroid addiction withdrawal, and Cynthia brings up a point, and that is the added stress from loved ones that think a person that's going through topical steroid withdrawal is nuts. Can you speak to that?
Well, my training and my orientation and my liking of medicine has a lot to do with the psychological aspect of the care and welfare of the patient. Must have that as a mantra of how you handle that human being, with the drugs you order, with the hand holding you do, with the phone calls that you should make, etc., etc., etc. That pulls them through. What, writing a prescription for an antibiotic, and goodbye, and you never return visit? It doesn't work. The antibiotic never works. They have nobody to... I've dealt with lots of ill people, not deathly ill in dermatology, but still they're worried about whatever it is they have, or cancer or skin cancer. And the worry can decimate certain personalities. Luckily, most of us are fairly well put together and we weather the storm, but we also reach out. We reach out to the doctor, we reach out to our spouse, we reach out to the family, we reach out to friends. Guess what I'm going through? And all of these folks help them get through it, understand them, and they walk away happy, pleased. They know they can turn to somebody. How miserable must these people be when they get, I used the word decimated a few minutes ago, decimated, strangled, ostracized, isolated by all the people who are dear to them. They don't know where to go. That's why they get more depressed. That's why they get suicidal.
Well, but not only suicidal, like that's a small thing. I'm not whistling past that, but if you're living in the bathtub and you're miserable and you're being told by your brother who's a doctor that you're a nut, that just adds insult to injury.
I'm not sure if this is an explanation. It's an explanation, valid or not. In America, we have so many options. So she knows there are 30 other dermatologists in her small town, in her fairly large town. There's also a university 40 miles away that she can drive to. There's also a bigger university 80 miles away that she can drive to. So she knows she has options, or she believes that all she's got to do is find the right doctor. And she gets squelched every time. Every time.
Yeah, she's just coming off Dupixent.
Yeah. And with the promise that I'm smarter than the rest of the crew that I call my fellow doctors, and I'll get you better. Or they don't say anything, which is even maybe worse. I get no support that this doctor knows what he's talking about. He's going to try something on me. He's going to try the new drug. I don't try drugs or medicines. I give nothing if it's of no value, and until I make the right diagnosis. And then once I have the right diagnosis, there's no trying. This is the drug that works. It's sad. It's so sad. And I think, okay, now this is where I'm trying to figure out, to answer your question properly. I think now I have the answer. You got a cold, lasts 3 to 5 days. You got a dance coming up next Saturday. You might miss it. You might not miss it. Oh, I hope he gives me the right drug. 3 to 5 days. Goodbye. Got a wrist fracture? 3 weeks in a cast. I'll be okay. This takes 3 to 5 years to be cured.
Nobody
no matter
believes
what
that.
we do.
But no reasonable person believes that.
No, I know that. But it's endless. They have no place to turn for years. It's got to be decimating. It's got to be. And then they're told by somebody, sooner or later, you're going to have this the rest of your life. Sorry, honey. We have to give you a shot of cortisone every once in a while. And indeed, calling me honey. And indeed, belittling me and my concern.
A pat on the head.
Yeah, pat on the head. It's just a rash. You'll live. Don't worry about it.
Well, but this is a condition, and I refuse to call it a disease. It's a condition of solitude and isolation because nobody's ever heard of it. And you call your mom and say, hey, Mom, guess what I've got? The first immediate response is, I've never heard of that before. Never heard of it before. And so there's no parallels or community generally in one circle to draw from.
Well, and also that, I'll give you some instances. That mother also has sent her daughter, or knows that the daughter went to the top dermatologist in their little town. How can they be wrong? My daughter, a fledgling at 23 years old, thinks she knows everything. Those doctors are doctors. I have it made psychologically when I've been doing the telemedicine, and there is a mother who supports the child, the patient, the teenager, or the spouse supports with going to me because they know that's what the diagnosis is. I got friends out there, and the patient has friends also. When I've got resistance, I got to work on the resistance. I got 12 extra patients I have to work through.
Will you reassure our friends out there and Cynthia who are off of topical steroids, flaking every night, not sleeping? Will you remind them that they'll be cured?
Whenever I see a new patient, or I'm on the phone or whatever, or I do it on the internet, my opening salvo, the first sentence is always, you will be cured, period. And cured is in all capital letters also.
Nothing.
And
Nothing
if I'm on the phone, I'll tease, I'll say, you can hang up now. There's your answer. You're going to be cured. Don't worry about it. And I say, I'm being light. I would never be light if this was a very dangerous diagnosis. I know you're going to be cured, so I can tease you a little bit. You're going to be cured, period. Let's get into the facts now.
And now we will begin.
Just like Philip Roth's book about Portnoy's complaint. And now we will begin the therapy.
Beautiful. Thank you very much.